this podcast, we're going to go over what an amine is. We're also going to talk about how amines are used in medicine and how to classify amines as well. All right, as you have already learned, amines are a group of organic compounds that have nitrogen in them. So they are considered to be derivatives of ammonia, which is NH3, and due to the number of valence electrons on ammonia, which is 5, nitrogen can make 3 different bonds. So we expect an amine to have 3 different bonds attached to that nitrogen. In a couple slides, we'll talk about this in more detail, but amines are oftentimes used in medicine as decongestants as well as sedatives. And we can classify them similar to how we classified carbons and alcohols as being primary, secondary, or tertiary. Obviously, we couldn't do a quaternary because nitrogen only makes 3 bonds. All right, so primary amine is going to be a nitrogen bonded to one other group. So here we have a nitrogen bonded to one group or 2 hydrogens, and the exception to this is going to be ammonia, where you don't actually have, and this one's ammonia, you don't actually have an alkyl group that it's bonded to, but that would still be considered primary as well. Secondary amines, your nitrogen atom is going to be attached to 2 groups. So here we see 2 groups attached to the to the amine, or you have 1 hydrogen attached to the nitrogen. Oftentimes we will write these in condensed structural formulas like you're seeing here, with the assumption that you have a methyl group, a hydrogen, and another methyl group attached to that nitrogen to make your 3 bonds. Finally, a tertiary amine is where your nitrogen is attached to 3 different groups or 0 hydrogens, which we see here. Sometimes, especially when we think about ammonia, I think it's easier to look at the number of hydrogens that are attached to your amine. So this could be 2 to 3 hydrogens, 1 hydrogen, or 0 hydrogens. There are 3 different classifications that you're going to come across when it comes to amines. And the first is an aliphatic amine, and that's where your nitrogen is only bonded to alkyl groups. So you can see in this tertiary amine, we only have carbons and hydrogens or alkyl groups bonded to our nitrogen. And they don't have to be the same groups. They can all be different lengths. They can be any length, really, as long as they're just carbons and hydrogens. The next type of amine is an aromatic amine, and this is where you have a nitrogen bonded to an aromatic ring. So here we see aniline. So we're going to start to see aniline as being a parent group for your amines when you're naming again. Just be aware that that's coming back up again. And finally, we have a heterocyclic amine. And heterocyclic amines simply mean that you have a nitrogen as part of your ring structure. So instead of having a carbon, you have a nitrogen instead. This specific heterocyclic amine is piperidine. And this is found in peppers. We're going to talk more about this in class and some of the other interesting heterocyclic amines. Your book will focus on asking you a lot of questions about naming heterocyclic amines. Don't worry so much about that. Get through those problems. We are going to worry more about heterocyclic amines when we talk about DNA, because DNA has heterocyclic nitrogenous bases. So we'll see it again then. Right, so here are some amines that are used in both over-the-counter and prescription drugs. All of these drugs, you'll notice they have HCl attached to them, or they have hydrochloride in the name. The reason that they have HCl or hydrochloride in them is because the drugs by themselves aren't going to be water soluble. So instead of selling them as they are, we're going to sell them as their ammonium salts. And as you remember from lab and pretty much the last unit, anytime we make something into a salt, we're going to increase its water solubility, which is good for people because people are mostly water. So you want the drug to be able to travel through the bloodstream, which is mostly water. Our first drug is Benadryl, or diphenhydramine hydrochloride. This is used as a antihistamine. It blocks your allergic response. So if you're having an acute allergic reaction to, say, a food or a bug bite, Benadryl is going to block the histamine from getting to your receptors in your body. Methadone is our next one. Methadone hydrochloride is a narcotic analgesic. This is given as a substitute for heroin addicts. It's also used for long-acting chronic pain as well. It's prescribed for both of those, but it is prescription only. Phenylephrine hydrochloride, or better known as Sudafed PE, is used as a decongestant. So you might take this if you have a cold, if you're having congestion. All right, let's talk about histamine. Histamine is biologically active. It's actually formed in tissues from the amino acid histidine. So your body can convert histidine as an amino acid to histamine. Histamine can bind to an H1 and H2 receptors in the body. When it does this, when histamine binds to these receptors, you're going to get some typical responses, what I liken to an allergic response. You're going to get vasodilation. Anytime you have dilation, you're essentially opening up those capillaries and your blood vessels a little wider. This is going to increase blood flow. You see this a lot at the site of an injury or an infection. You're also going to get all those symptoms of allergies that we associate with histamine. You're going to get runny nose, watery eyes, kind of redness of the skin, although that is due to the vasodilation as well. When we have histamine released around the stomach, it will stimulate the secretion of acid. So, how do antihistamines work? Antihistamines are going to bind to the H1 receptor. So it's going to inhibit vasodilation, so you're not going to get that redness or that increased blood flow. Usually we use antihistamines binding to the H1 receptor to treat cold and environmental allergy symptoms. However, because of the nature of your antihistamines, depending on what you're taking, let's say you're taking Benadryl, these are going to cause drowsiness because they're crossing the blood-brain barrier, and they're then going to bind to H1 receptors in your central nervous system. So nowadays, we are so lucky, we live in a great time. You have drugs like Allegra. Allegra is used to treat seasonal allergies, and it binds to the H1 receptor as well, so preventing that vasodilation. However, it can't cross the blood-brain barrier, so it therefore does not bind to the H1 receptor in your central nervous system, and it does not create any drowsiness. We also have specific drugs that bind to your H2 receptors, but these drugs that don't bind to the H1 but bind to the H2 instead are going to produce a different response. We use these drugs to reduce acid secretion in your stomach. Think of anti-ulcer medications